Hello, I'm Dr. Graham Good. I'm the Deputy Medical Director here at Blackpool Teaching Hospitals, and I'm here to give the COVID update for the 23rd of March. Sadly, the numbers of COVID seem to have gone up again. Certainly in the Trust we now have 100 patients where we had 73 last week, 2 of which are on critical care, whereas it was 1 last week. And this is played out across the community, whereas the transmission in community has certainly gone up and probably doubled. In Blackpool it's now 645 where it was 377 last week. We have filed of just under 700 at 699 where it was 361 last week. And Wyre is 785 where it was 393. So there does seem to be a very infectious variant of Omicron called BA2 which is driving this. Now, fortunately, most of our patients still are not getting as sick as they were in the early waves, and certainly that's testament to the vaccination programme and changes in the variants of COVID itself. In terms of vaccination, you've probably seen in the news that the 4th dose now as a booster has been offered for patients who are vulnerable, and particularly those over 75, but those less than that if they have certain conditions which damage their immune system. So if you are in those groups, you will be contacted directly, and you'd have to have had your 3rd booster dose around 6 months ago, and certainly not before 3 months. Just again as an update from the hospital, in our daily lives we don't have to use masks. It's certainly optional, whereas in healthcare environments it's still mandatory. And I would ask you to respect our rules and make sure that you do wear masks in the hospital environment, because we do have a number of immunocompromised patients and particularly vulnerable patients, as you would expect, and make sure that you wash your hands and clean your hands when you enter the building. Just in terms of positive news, we are now in the process of about to deliver a 24-bedded modular ward which will aid the pressures that we're currently under for beds. And this looks to come online probably by the end of the month, or certainly in early April. And that will provide a bit of a boost to us in terms of aiding flow, because at the moment the emergency department is highly pressured as it is up and down the country. So I'd ask you to make sure that you need to go to the emergency department. If you're not sure, do ring 111 and they will give advice, and that we do have some booked appointments rather than waiting a long time in our emergency department. The other positive thing going on with the emergency department is we are currently in the middle of a development to provide a department which gives same-day emergency care. So these are patients who don't require admission but need some diagnostic tests, support and therapy, and we can turn these patients around in a day. And this new development will be opening in August of this year. After that, we are doing some other changes to our emergency department to make it a better environment for our workforce and a much better environment, a safer environment for you as patients. As part of that, we've also got a new critical care area which will provide state-of-the-art facilities, and this will be opening in August, September this year also. So luckily the weather's good at the minute, so enjoy the sunshine and please stay safe.